Hey everyone, so I know it has been super long since I have made any videos. The last time I posted a video was in May of 2021, which was a little more than 2 years ago. Sorry I haven't been posting like updates on my recovery and just how it's been going, but I have been communicating with people through the comments. Any questions that they have or like concerns that they have, I definitely try to respond to everyone. I try to be as detailed as possible because I just want to help people, like somebody who may be going through the same thing I'm going through or something similar, or it just helps them somehow. I will try to post more videos relating to like my experiences and everything. So what do I want to talk about? As you all see from my other videos, I had my right submandibular gland removed. It was over here, right there, right here. You can see that it healed pretty well. Let me get a little closer. So like if I'm like this, you don't really notice it too much. This is the left side and the right side. I mean, it heals pretty well into the folds of my neck. I mean, you could see like the line is a little bit higher, but overall it healed pretty well. So when I had the submandibular gland removed, that day was like a whole day of waiting. I had to be at the hospital for 6:30 in the morning. I was sitting there and waiting for hours and hours and hours, and the person who's there waiting for you, like from when you finish surgery, was not allowed to be with you at that time. They had to go sit in a waiting area, which was all the way on the first floor. I was on the 10th floor or the 11th floor, I can't remember. 2 or 3 o'clock, I asked the nurse if I can use the phone to call someone to let them know like that I'm still sitting and waiting. So I called and I told them that I'm still sitting and waiting, that I have not had the surgery yet. And he was like, what? Yeah, I did not go into the surgery room till about 5 o'clock, close to 5 o'clock. I remember I did not feel scared until the moment I went into the surgery room. It was weird, like I just wouldn't let it really cross my mind. I wasn't thinking about it too much. I was just like, whatever, I have to do it, whatever. But I remember when the surgeon came for me, she said we have to walk down the hall into the surgery room. So me and her, we just walked and we were talking, and she's telling me that she's done this surgery so many times that it's like nothing to her. That is very reassuring to hear that your surgeon has a lot of experience. So I remember seeing the door. It was shiny silver metal door, and I'm like, oh my god, like it just looked like one of those rooms like you go in and you don't come back out. And then like I started to feel a little cold, and then I went into the room. All I saw was like a little cot, or a little bed, the little cot bed that they put you to lay on, and just a room full of equipment and a few people. When they asked me my name, I started crying. It just hit me that I'm gonna have surgery, and I just became so overwhelmed with like fear. And then as I'm saying my age and my date of birth, I'm like, my mouth is trembling and I'm crying. And then I remember them telling me to count backwards from some number. So I started counting, and then like I was knocked out. And that was it, I guess. And then they did the surgery. And I remember when I woke up, I was slowly waking up. And you know when you have like that groggy feeling and like you're not really sure like where you are or what's going on? Couldn't move my legs. I didn't realize they had like the compression things they put around your two legs to like help circulate your blood. So I barely could like make out that a person was sitting not too far away. It was the nurse. So I'm telling her, I was like, I need help. I can't feel my legs. But then she told me that the compression things are on my legs. And then I keep falling asleep. I was so drowsy. Whatever medication they gave me, it didn't wear off because I was so tired. And then the nurse kept trying to wake me up, and she's telling me, you have to go now. And I remember my husband, he was standing there, and I'm just staring at him, and I was just tired, so sleepy. And I remember as we're walking out of the hospital, I started to feel so nauseous and sleepy. I just wanted to sleep. So we're going home. My nausea just started more. I had to go to my parents' house. So we got there. I tried to eat soup. I just did not have the appetite for it. I could not manage eating anything. And then we left and we went home. I remember when we got home, I grabbed a plastic bag and I just started throwing up. I threw up so much clear liquid. I felt miserable. But after that, I started to feel a little bit better. And I just slept. All I wanted to do was sleep. I gave painkillers that I had to pick up from the pharmacy the next day. But for that night, whatever I had was enough. The next day, I was perfectly fine to eat. I did eat a lot of soup for 2 weeks. But later in the night, I had Thai food and coconut water. Oh my God, it was so good. I had no problem to eat whatsoever. I spent most of every day for 2 weeks sleeping. The pain pills were making me very drowsy. I remember they gave me Percocet. When I would take that, it started to make me, you know when you're like hallucinating a little bit? I was sitting on my bed and I just looked at the door and I can see the door like going like this. And I'm like, no, I know that's not happening. I said no. So I called the hospital and I told them that medication is too strong for me and it's making me feel a little dizzy and like see stuff, and I don't like that. So they ended up prescribing ibuprofen. Every day the pain got a little bit less. After a few days, you have to go to get your stitches removed. So we went back to the hospital. They took out the stitches. It was three stitches here. And she took it out and she said, use Aquaphor healing ointment. She said it will help heal the incision and it will help prevent itching. It will prevent like the dryness and pain because it will keep it moist and it will just help with the itching. And let me tell you, it really did, because not once did it feel itchy for me. I feel like my incision is not really noticeable unless like somebody knows or like you look pretty closely. I'll show you guys again. I mean, you could see like the difference from both sides, the side with the incision and the side without the incision. This is without, this is with. But I mean, I still feel like it looks pretty good. So with that surgery, removing the submandibular gland, one thing that really did bother me was the swelling. This whole thing was like this. I don't know. I felt like a frog. I was so self-conscious. I did not like how I looked. I didn't. At that time, people were wearing masks like all the time. I would wear it even in the house. Like I would put the mask on and just keep it here to block this whole area. Not over here, but like from here down. And it would just cover the whole thing. I feel like that swelling took forever to go away. The part where the incision is, it felt very hard to the touch. But when I did bring it up to the doctor, the surgeon, she said it's normal, it's just part of the healing process. Another thing I do want to mention was with that surgery, where my incision was, that whole area from here to here, this whole section right here, I had absolutely no feeling. I was completely numb in that area. You know, I don't know if you know, but like when you go to the dentist and you get the numbing medication to like pull out a tooth or like for wisdom teeth extraction or something, you know that numb feeling you get in your mouth? That's the feeling I had here. And that feeling lasted for months. It wasn't until about 6.5 to 7 months later I started to get back feeling in this area, but I didn't get back all the feeling right away. It took a long time. It took a total of 1.5 years for my feeling to come back in the whole area. I was scared. I thought it was like they did something wrong or it just wouldn't get back feeling. But my surgeon said, if you don't get back feeling within 1 year, your chances to get back feeling are pretty much done. But for me, I got it half a year later. I still got it up to 1 year plus a half a year. So 1.5 years it took for me. And I'm grateful. It's like when you don't feel or like when you lose something, that's when you like learn to appreciate it more. I know a lot of people ask me questions in the comments. I hope I've answered most of everyone's questions or any concerns that anyone has had. Anything you guys want to know, you can ask in the comments. I reply to everybody. Even if I don't see it right away, when I see it, I do respond. The reason I haven't been making videos and posting is because after I did my biopsy, I remember when I did the biopsy, the doctor told me it's benign. The lump that I had is benign. But I was like, I literally begged them to remove it for me. That's like a whole nother video to talk about. But when I did get the surgery and they did the biopsy on the actual thing that they took out, it wasn't benign. Like, that was a whole it was a whole journey, and I couldn't talk about it. I just couldn't like talk about it in a video and post it. I was mentally not okay. It took a long time, but like I said, that's just a whole nother video. But I do want to leave with one important message to everyone. If you feel like something is wrong in your body, and like you know something needs to get done, or you need something removed, just try your best to find some doctor that will take you serious. Because for me, I had my lump for a total of 7 years that I knew about it. It started off super tiny, and over the years it got bigger. Before I actually was able to see it or feel it, I don't know how long before it was there. So it's more than likely possible it could have been there more than 7 years. So if you take anything from this video, please, please, please find the doctors that will take you serious and that will try to have your best interests at heart. Because I've had some, there's just no words. I hope you guys find some answers to any questions you maybe had or anything you wanted to know. So I will see you guys in the next video, which will not be in 2.5 years. I will try to make videos more often because mentally I'm in a better place, and I feel like I can talk more now. So if you have made it to the end of the video, thank you. So bye.